Hey guys, it's Sarah. Guys are probably getting tired of these health updates. Trust me, I'm tired of giving them. My name is Sarah, and today I got probably officially diagnosed with chronic pancreatitis. So I have a lot of mental health issues, so I do take mental health medications. And anybody who takes these type of medications, just be aware, which I was not aware, so now I'm in this situation, is that it affects the pancreas. So, chronic pancreatitis is different from acute. So, acute pancreatitis is reversible. Now, unfortunately, I don't have the reversible one, which is crazy. So, let me tell you a little story. On New Year's Day, I woke up. Wasn't even awake 30 minutes. I was just laying in bed watching TikTok on my phone, like I do a lot of the time. Well, I woke up, had such excruciating abdominal pain. I could not stand it. I was crying. I was like, it was horrible. Like the pain, if it was like a 1 out of 20, it would have been like a 20. But on a scale from 1 to 10, it was definitely a 10. It was horrible. Um, I tried to take something to calm it down because I've had to take Bentyl before for abdominal pain, but that didn't work. And I didn't really give it a chance to kick in because of the issue of, me being in so much pain. I was like, oh no, I can't wait. And as you guys know, I've been living alone since about mid-August. So I live alone, so this is horrible. So I again have to call the ambulance on myself. So I call 911, the ambulance comes. I sit outside for a minute waiting for them to come. And I'm just sitting there bawling and my stomach's hurting really, really bad, my abdominal area. Now, mind you, I have acid reflux, I have gastritis, which is the inflammation of the stomach. Um, I've kind of explained that in other videos, but so they took me in the ambulance. The ambulance sat in the parking lot for a good little bit in my apartment parking lot. So I could they were giving me IV fluids, they were checking my blood pressure, they checked my blood sugar, and mind you this, I am not diabetic. I don't have much sugar. Now, when I was younger, when I was a kid, I had a lot of sugar, right? But in the past, like 6 or so more years, I don't really have that much sugar because I don't want to be a diabetic. So when they pricked my finger in the ambulance, they said that my blood sugar was up, and I looked at it, I'm like, I'm not diabetic. And so they gave me IV fluids until I got to the hospital. They kept the IV fluids in me when I got into the hospital as well. But they said my blood sugar was up. So eventually, after a whole bunch of like tests that they did in the ambulance, they gave me some aspirin, and they have chewable aspirin. So they gave me that. That didn't help. So they say, okay, well, we're taking her to the hospital because she says she wants to go anyway and she's in a lot of pain. So I get to the hospital. The paramedics helped me get into the bed. I didn't have to get up, which was nice. And then there was, I'd say at least like one lab person that came and took my blood, one that gave me more fluids and gave me pain medication to stop the abdominal pain because it was so bad. Like, it was horrible. So I laid there for a while after they gave me some fluids and some pain medication. Many of them came in and asked, what's going on and all that kind of stuff. So I explained this whole thing to them. That, by the way, it's the second time it's happened. I have made a video about this before. So they did some blood tests. I was laying there for a good bit, and I was kind of nodding on and off because they gave me pain medication. It was making me feel a little woozy, which it stopped the pain a good bit, so I was fine with that. And I took a little nap. I'd say about 45 minutes to an hour later, a nurse comes in, and she was a nurse helping me. And she says, well, miss, I'm going to let you know that you have chronic pancreatitis. Your pancreas levels are up 405 milliliters than normal. She said, you're lucky it's only 400 something milliliters. If it was 1,000 milliliters, your pancreas is pretty much done for. She said that my pancreas is slightly damaged. And she said that the blood sugar is up. So when the pancreas is acting up, the blood sugar goes up. And because I told her, I said, well, I'm not diabetic. And she said, well, your pancreas levels are up. And your pancreas levels are up, your blood sugar goes up. So that means your body's not producing enough insulin, and that is why it's giving you abdominal pain. So she says that this is the start of you having pancreas problems. And I was like, great. So fast forward to today, from New Year's Day to today. Today's the 10th, I believe. Yeah, January 10th of 2023. So that was New Year's Day when I went in. Yeah, the first day of New Year's Day of the new year, and I had to go to the emergency room. So fast forward to today. So today I did a follow-up with my primary doctor. The ER told me to, so I did what they said to do. And they said that they gave me a printout. My doctor gave me a printout, my primary doctor. Now, he has very good knowledge of pancreas issues, but this is more for my gastroenterologist, which I already have an appointment with him next month, so it's going to get more in depth. But he gave me a printout of, hold on, let me get it real quick. So he gave me a printout that says, I have chronic pancreatitis. I'm like, really now? So this is why that nobody should be on mental health meds. And they are good for a certain amount of time, but I've been taking these a lot of years. I would say almost about 10 years. And I take 2 of them that apparently cause pancreatitis. So I have severe insomnia. I have to take a pill to sleep, and apparently the sedative medications that people get, like, let's say trazodone, let's say, which I am taking right now, which I'm probably going to stop taking because my pancreas is inflamed, so that's going to make it worse. I also take Lamictal, and Lamictal makes it worse. So I might have to get off of 3 medications. And I can tell you right now, Lamictal is hard to get off of. It is super hard. It takes the longest. What I am concerned about is not just about my pancreas. That is a whole nother level of an issue, because that can be fatal. It can kill me. And I'm 31 and I don't need this. So I hope that, I'm already going to get off the Seroquel. I'm getting off of that, because that is probably the main cause, along with the Lamictal. I'm probably going to have to get off that, because I've been doing some research in the past few hours, and apparently a lot of mental health medications, they attack the pancreas. Now, my primary doctor is ordering me a CT scan to see how damaged my pancreas is. So acute pancreatitis is reversible. Chronic pancreatitis is not. And apparently I have chronic pancreatitis. And so, like the signs and symptoms I had was sometimes I get really hot for no reason. I feel nauseous. I vomit. I get a fever, or feel like I have a fever, but then my blood pressure was also up a little bit. Now doctors say, 158 over something is not high, but for me it is, because I was not feeling well at all. I was down at least for a few days after that. Now on and off, when I eat, I do sometimes get pain. Like right now I'm having a little bit of pain, but it's not excruciating. So, but I have to really watch what I eat, and whatever the CT scan is going to show is what I'm really worried about. because my pancreas levels are up 404 milliliters than normal. So I don't know what normal pancreas levels are, but 404 is, you know, it's up there, but it's not 1,000 milliliters. Luckily, I don't want it to get that way. So, excuse me, the doctor, my psychiatrist, he wants to take me off the Seroquel, and I'm game for that because I've been fainting on Seroquel. I've been having a hell of a time with it, and I know for years and years and years, I did not have problems with this medication. It was the thing that helped me with my insomnia, because I have really bad insomnia. I don't take a pill to sleep. I don't sleep. So, you know, I'm battling sleep. I'm battling depression. I'm battling anxiety. I'm battling acid reflux and a whole bunch of other issues. So this just adds on to it, and it just sucks. I'm just gonna be totally honest. Like, it actually scares me to death because it may end up that I have to get my pancreas removed, may have to get my gallbladder removed. Now, if I get my pancreas removed, I can live without a pancreas. But the thing is that I can be more at risk for diabetes. And I'm not diabetic. You know, like, they've tested me for diabetes. I'm not diabetic. So, I mean, also Seroquel can induce ketoacidosis, which is diabetes. So it can cause diabetes. It can cause pancreatic damage. So now I have pancreatic damage. You know, it's a constant battle. I mean, you guys have seen how many videos I've made about health issues. Now, mind you, I'm only 31 years old. Okay? I was born with fetal alcohol syndrome. That was my main diagnosis. When I was a kid, in my early, you know, my teen and adult years, I was totally fine till I started taking these mental health medications back in 2013. And I regret being on any of these medications. To me, it is not advised to do it. Now, not dealing with mental health without medications is not good either. But it's just those mental health medications alter your digestion, which can lead to pancreatic damage. And yeah, I'm not too happy about this. I'm actually scared to death that I'm going to die from this. I'm scared that I'm going to have to go undergo surgery to get my pancreas out, or my gallbladder, or I got gallstones or something like that. Like, I'm way too young for this. Like, I'm actually having to redo my advanced directive just in case something happens to me where I cannot, you know, think for myself. And, you know, I really don't know what's going to happen to me. I don't know if it's going to affect my life where I die from this. Because it can be fatal if you don't get this treated. It can get septic, which septic is like where it goes into the bloodstream if there's an infection. And it can kill me. So, you know, I got a lot of stuff going on. And I'm really hoping that it gets better. Because without eating, if you feel like you can't eat even one bite of food without thinking your pancreas is going to hurt, that's scary. It's very serious. And I am going to be trying to document this just because I want to, and to get the word out to people that may have pancreas issues. And if I was not taking these mental health medications, I probably would not have these problems. Because, I mean, doctors, they look at my medications, they don't think it's my medications. And I'm like, well, I've never had this problem before. All my organs have been all very healthy, you know, even though I have fetal alcohol syndrome, and that's not healthy. So also might have to be something to do with my brain not being, you know, like the receptors in my brain just, you know, sending signals to my pancreas. But now it's not just a receptator in my brain, it's my actual pancreas. So I'm hoping that I can beat this. I'm hoping that I can just, you know, live, you know, because I'm battling so much. I got endometriosis. I've got I'm high risk for cervical cancer. I've got very bad mental health. I've been through a lot last year. The new year, I thought, oh, this is going to be great. But instead, no. First day of the new year, I have to go to the emergency room in an ambulance because I have chronic pancreatitis. And I found out this today by what my primary looked at of my tests in the emergency room. And he said, well, you definitely need to get a CT scan. So he ordered that. He also ordered some other type of medications to help me until then. And I have to go see my gastroenterologist. Like I mentioned before, he's the one that mainly looks at digestive disorders and stuff. And I've been to him before, but I might have to get a procedure where he has to look and see if my pancreas, like, ducts are clogged, you know, or something like that. Like, it's some serious stuff. So, yeah, subscribe and like. You don't have to like, because if you like, it's not something really to like. If you dislike, that's fine. If you want to comment, you can comment. Any prayers, anything would be great. So, yeah, I just want to make this video just because I haven't made a video in a little while. Except for my baking video. I love doing that. I love doing just random videos. So, yeah, I just wanted to make this video, and fingers crossed that I'm going to be able to beat this, because this is just all too much for me, and it's all too much for anyone. Even if I'm a kid, or, you know, kids or anything, just anybody going through any type of organ issue in the body, yeah, I feel for anybody who's having to go through this. So, I appreciate anyone who clicked on this video, and I will see you guys in the next video. Bye.